This is a quick introduction to our topic of maladaptive daydreaming. I shall be discussing this mental health issue and the reasons why it develops. Maladaptive daydreaming is a mental problem that causes the person to daydream so vividly and so drastically that it can become an addiction, cause life-altering problems, and take up hours at a time, etc. When it comes to maladaptive daydreaming, it can usually start from a very young age. From baby to toddler to child, you start to daydream more often as your mind is usually much more active and creative during your childhood. Unfortunately, if these daydreams continue more than average, the daydreams will become more real. That is when this leads to maladaptive daydreaming, where, for example, the person starts to pace around a room envisioning these scenarios or acting out what's happening in their head. Rather than your typical daydream, which is staring at a wall doing nothing, maladaptive daydreamers are usually a bit more active in motion or facial expression. Some other reasons as to why maladaptive daydreaming starts is to escape something, boredom, loneliness, and large life changes. All of these play a factor as it can influence you to retreat into your mind, make up these scenarios to exit out of real life problems or situations. These types of situations are usually common in adults as they have jobs and major responsibilities, so they desire an escape. Do keep in mind, maladaptive daydreaming can develop at any age, but it's usually common to develop in one's childhood. Well, that's all I have for today. I hope you have become more educated on the topic of maladaptive daydreaming. We will discuss more in this podcast, such as how to cope with this mental health issue. Please remember, I am no doctor, psychologist, psychiatrist, social worker, or nurse. I am simply a college student who wants to spread more awareness on the subject of maladaptive daydreaming. You should not use this as a way to diagnose yourself. Please seek those who work in the mental health field to get a proper diagnosis. I have used trusted resources for correct information on the subject. Thank you, and remember to stay strong.